Tungiasis, caused by the female sand flea Tunga penetrans, is a significant health concern in many impoverished tropical communities. It presents a wide range of clinical issues, often leading to severe complications. The treatment options available are limited. In this research, the effectiveness of intermittently applying the plant-based repellent Zanzarin to decrease infestation levels and the associated health problems caused by Tungiasis in a resource-poor community in Brazil, where the attack rate was notably high. Divided the study population into 3 groups. Initially, for 4 weeks, all members applied the repellent twice daily to their feet, resulting in a remarkable reduction of embedded sand fleas to 0 in 98% of the participants. Following this, Cohort A continued applying the repellent every second week for 1 week. Cohort B did so every 4th week for 1 week, while Cohort C acted as the control group. Over a period of 5 months, monitored infestation levels and Tungiasis-related health issues. The intermittent application of Zanzarin every second week significantly decreased infestation levels during the entire transmission season compared to Cohort B, applying every 4th week, and the control group, which had 3.5 times higher infestation levels. Additionally, Cohort A exhibited significantly lower Tungiasis-related health complications compared to Cohorts B and C, emphasizing the substantial benefits of this intermittent repellent application in reducing morbidity associated with intense Tungiasis transmission. Study highlights that in areas with high transmission rates, using a plant-based repellent intermittently can effectively minimize the health impacts of Tungiasis. Please remember to subscribe to our channel, click the like button, and activate the notification bell if you wish to see more content like this. Thanks for watching.